Have you ever considered that in the next minute, 200 unintended pregnancies will occur worldwide? How can we change this statistic? Hi everyone, my name is Dr. Jodianne Fletcher, and today's topic is contraception conversations. Navigating your options. The purpose of this video is to empower you with knowledge about birth control options so that you can confidently make informed decisions about your sexual and reproductive health. Firstly, what is contraception? I may use the words birth control and contraception interchangeably in this video. Contraception refers to the deliberate and planned use of various methods to reduce the likelihood of becoming pregnant after sexual intercourse. The primary aim of contraception is to avoid unintended pregnancies. What are the benefits of contraception? Contraception offers numerous benefits. One of the primary benefits of contraception is its ability to prevent unintended pregnancies. This helps to reduce abortion rates, especially in regions where safe and legal abortion services may be limited. Contraception also empowers individuals to make informed choices about their reproductive health. It allows them to have control over when and how many children they have. Many contraceptive methods offer health benefits for women, such as treatment of certain gynecological conditions like ovarian cysts and endometriosis. Some hormonal contraceptives can also help minimize menstrual symptoms, such as heavy bleeding. Family planning through contraception can lead to healthier pregnancies and births. Spacing pregnancies through family planning can reduce the risk of complications in the mother and baby by allowing the mother to be healthy with any underlying illnesses well controlled prior to becoming pregnant. While most contraceptive methods do not protect against STIs, the consistent and correct use of barrier methods, like condoms, can help reduce the risk of contracting or spreading STIs. You may be asking yourself, how will I know which contraceptive method is right for me? Different birth control options will target different benefits, and that is why it is important to know your options and the specific goals you have in mind. Here are some key considerations to weigh when selecting a contraceptive method. I like to consider the factors in terms of those related to pregnancy goals, other health benefits, ease of use, side effects, and other factors that do not fit any of those labels. Do you ever want children? Reflect on your future family planning goals. If you want to have children in a few years, a reversible method may be suitable. If you're done having children, you might consider permanent options such as the tie-off. My second question to you is, how long do you want to wait before attempting to have children? Determine whether you are looking for a short-term or long-term contraceptive solution. Short-term methods like condoms or the pill may be suitable if you're planning to start a family in the near future, while long-term methods like IUDs or implants can provide years of protection. Now that you have considered your pregnancy goals, is there any other benefit you would like to get from the birth control method? This could include protection from sexually transmitted infections using a barrier method. If you have irregular or heavy periods, hormonal methods may help to correct this. Let's talk about ease of use. Think about how easy it is to use the method consistently and correctly. Methods that require regular maintenance or attention, such as taking a daily pill or using condoms, may not be as convenient for some individuals as methods that require less frequent attention, like an injection or implant. Now that you have an idea of what things you want in a contraceptive method, what things do you want to avoid? Let's talk a little about side effects. Different contraceptive methods can have varying side effects. Consider what side effects you are willing to tolerate. For example, hormonal methods can cause changes in menstrual patterns and mood, while copper IUDs may lead to heavier periods. Also, when considering side effects, your medical history is important. Some methods, like hormonal contraceptives, may not be suitable for individuals with certain medical conditions, while others, like copper IUDs, can be used by most people. Speak to your doctor to find out which contraceptive method would be right for you. Let us talk more about the different birth control options available. Commonly used birth control options include condoms, oral contraceptive pills, implantable rods, intrauterine devices, and sterilization. Did you know there are male and female condoms? It's true. Condoms must be used every time you have sex in order to prevent unintended pregnancies. A really great benefit of condoms over other forms of birth control is that by forming a barrier, it protects against some sexually transmitted infections. However, there are quite a few downfalls to consider. Allergic reactions can occur, such as to latex, in which case condoms can be bought that are made of other materials. Female condoms may cause discomfort on insertion. Overall, condoms are not very effective as a birth control. With consistent usage, if 100 women went to restock on condoms, 18 to 21 of them would have an unintended pregnancy. One can consider using a condom with another form of birth control to maximize the benefit of protection from infections with birth control benefits of the second methods. Oral contraceptive pills are to be taken once a day. They contain hormones that help to reduce the risk of becoming pregnant. If 100 women went to the doctor to get a prescription for the pill, only 6 would get pregnant. That is actually pretty good, don't you think? Another benefit is that the pill can help treat other period-related issues, such as heavy or irregular vaginal bleeding. The downside to taking the pill includes bleeding between periods, feeling like you would like to vomit, breast tenderness, and headache. Also, remembering to take the pill daily can be troublesome to some. When considering this option, it is important to tell your doctor. If you have high blood pressure, a history of migraines, blood clots in yourself, or a close family member that required medications, as well as if you smoke cigarettes. Implantable rods are inserted by a gynecologist. It's a tiny, flexible rod placed under your skin that provides up to 3 years of contraception. Using the previous example of women going to get this implant, less than 1 out of 100 women would become pregnant. It is not quite zero, but it is pretty effective. The downfall to the implantable rod includes menstrual changes, mood changes, weight gain, acne, and headache. Intrauterine devices are small, T-shaped devices that are inserted in the uterus by a healthcare professional, providing long-term birth control. They are highly effective, require minimal maintenance, and can be removed whenever you decide you're ready to start a family. There are 2 main types, one with and one without the hormone. Progestin, the intrauterine device with progestin, releases a small amount to affect the womb only, which leads to lighter periods or, in some cases, no periods at all. They protect against pregnancy for 3 to 5 years. The copper IUD, on the other hand, does not release any hormones. It offers up to 10 years of protection and can be used as a form of emergency contraception after unprotected sex. It may cause heavier menstrual bleeding and cramps. The injection form of contraception contains a similar hormone that helps to prevent pregnancy once injected every 3 months by a healthcare professional. The injection can be in the arm or into the buttocks. 6 out of 100 women would become pregnant using this method consistently. The downfall to this method includes loss of bone density, bleeding between periods, headaches, weight gain, nervousness, dizziness, and abdominal discomfort. This method may be available at clinics in Jamaica. There are natural methods of contraception that include fertility awareness, where the individuals will have to recognize when they would be most likely to become pregnant. There are several menstrual calendar apps that can assist with this. There is also the withdrawal method, where before ejaculation, the penis is withdrawn. With these methods, if 100 couples attempted either, over 20 couples would become pregnant. There are permanent forms of contraception. This involves a surgical procedure where the patient's tubes that transport the egg in women or the sperm in men are disconnected. This procedure is highly effective. Common side effects due to this procedure include pain, bleeding, and infection. Emergency contraception is the use of a method shortly after sex in order to prevent pregnancy. The 2 main types are the emergency contraceptive pills as well as the copper intrauterine device. The pills are available over the counter at most pharmacies and can be taken up to 72 hours after unprotected sex, and some brands can be effective up to 120 hours after unprotected sex. Possible side effects include menstrual changes, lower abdominal pain, headache, nausea, dizziness, vomiting, breast pain, and tiredness. Alternatively, the copper intrauterine device is a highly effective emergency option that can be inserted by a healthcare professional up to 5 days after unprotected sex. It not only prevents fertilization, but can also act as ongoing contraception if you choose to keep it in place. It's important to remember that emergency contraception is not meant to replace regular contraception, but it's a safety net in case of unexpected situations. The sooner you act, the more effective it is. Consult a healthcare provider or pharmacist for guidance on the best option for your situation. I said a lot, so here's the takeaway message. Contraception facilitates the prevention of pregnancies and allows individuals to have better control over their reproductive health. Different options exist to meet the specific needs of each individual. However, there's no one-size-fits-all contraceptive method, and what works best for one person may not be suitable for another. It's important to have an open and informed discussion with a healthcare provider to select the contraception method that aligns with your individual needs and goals. That's it for today's video. I hope you learned something that you could use to help you or a loved one on your wellness journey. If you did, please like, share, and subscribe. If there is a topic you would like me to discuss, please leave a comment below. Remember, knowledge is the first step to wellness. Thank you and have a wonderful day.